remember, be surrounded. And we're going to be talking about sunglasses, sunlight, suntan cream, and anything regarding to do with light. And just a privilege to have him. He's a medical doctor, board certified in internal medicine. He's a genius in my eyes. And so we're going to unpack just 3 questions on this video, all to do with the sun. And so, Dr. Stillman, thank you so much, and welcome to the show again for the second time.
Thanks for having me. It's glad to be here.
We're going to jump right straight into it. And the first question is, why is sunlight so important for our health?
So I really usually break this down into really 2 major benefits that people get. So number 1, we need the sunlight to set our circadian rhythms. Otherwise, we do not have the melatonin that we need at night to really regenerate and rejuvenate our bodies. So one of the most consistent things I see is people coming in, they say, I'm tired, I don't get restful sleep, I can't recover from my workouts. And I talk to them, and a lot of what they're doing late at night is they're around very bright objects that are, disrupting their circadian rhythms, disrupting their melatonin release at night. And so this is one of the first things that I work on with them, and they get better sleep, more restful sleep, they feel better. Part of this is that the red and infrared light from the sun fuels melatonin production within the skin and the eye. And so if you're not getting that light during the day, and if you're under harsh fluorescent, very bright LED fluorescent lights, if you're not getting that light, you're not going to have the melatonin that you need. And so the intensity of the light matters as well for the production of other hormones and neurotransmitters. So people who have seasonal affective disorder and are using these day lamps that are very bright, what they're really doing is they're using light to augment the production of the hormones and neurotransmitters that help us to feel happy and normal. And the reason that those wane in the winter is that the light from the sun is less intense. So a lot of people are treating these disorders with day lamps. What they really need to do is get outside into the sun. And then there's, obviously, as we've talked about, lots of different ways to supplement that with therapeutic lights.
Okay. So melatonin is crucial for just well-being, for sleep, even for maintaining a healthy weight. As an antioxidant, are you saying that melatonin should be prized as one of the most important endogenous hormones that we've got?
So it is, I think, the most potent antioxidant in nature, unless what I've read is now out of date. It's several times more potent than vitamin E and vitamin C that people are taking, left and right for everything. And what people really need to understand about melatonin is that it's produced in different parts of the cell in response to different stimuli at different times of day. And so a lot of people tell me, well, can I just take a melatonin supplement? And I say, well, your body's designed to make it in response to light and to release it in response to light. So taking a supplement is a little bit like, turning on the fire hose at the curbside of your street and expecting it to do the dishes in your sink, or wash your hands in your bathroom sink. You've got to allow nature to really work the way it's supposed to work in order to get the best outcome. So I stress with my patients that what they really need to do is they need to copy nature. They need to mimic nature. That's the most important thing for them to, and the most easily grasped framework for them to create a healthy light environment.
Now, why has the sun been sort of vilified, and we've been told this narrative of this story that the sun causes cancer? Is that not true?
So at the end of the day, sunlight, when it's very strong on skin that's not conditioned to it, can create a lot of photo damage. But we know from studies in people who are exposed to the sun occupationally, in other words, people who are manual laborers outside, whether they're stringing telephone wires or digging ditches or building houses, they don't have an increased risk of melanoma, the most deadly type of skin cancer. And even the other thing that I stress with people is that your risk of any cancer is really dependent upon far more than just one factor. Are you eating the right diet? And overwhelmingly in the literature, the biggest risk factor for skin cancer of any type is burning. And so what you want to avoid is sunburn. Okay. And so that's the thing we have the most robust data for. And then for anyone who wants to avoid any kind of cancer, you've got to lead a healthy, balanced, wholesome life.
There were studies saying that indoor people that work indoor in offices under this junk light have far more increased chance of getting the melanoma, the most dangerous skin cancer of them all, compared to people who work outside.
Right. And it's very compelling to look at that data and think, well, what are we really missing here? And as you and I have talked about before as well, there's a lot of mixed data on sunscreen. Is sunscreen part of the problem of skin cancer? And one of the problems that we run into in the literature is that no one is doing trials in a way where they look at different formulations of sunscreen and test those specifically. Okay. Not all sunscreens are the same, just like not all supplements or not all vitamins, not all minerals are the same. It's a little bit ridiculous to say, well, vitamins stop cancer. Well, which vitamins and what dose for how long in what population? Now, which cancer, right? And so these are real details that frankly the dermatologists ought to be working out right now instead of doing more and more drug company funded studies for what medication is going to fix psoriasis next year.
So what about these sunglasses? Do you advise that people wear sunglasses? I mean, it's so trendy and it's become so part of our lives, but do we wear them?
Right. So I don't wear them. And the reason is that, that sunlight coming into your eye sends the signal to your brain to produce hormones and neurotransmitters. And particularly people who struggle with depression, anxiety, any kind of mood disorder, what I'm telling them is, look, your brain's neurotransmitters and hormones that you're struggling to balance in your life are fundamentally controlled by light. Not completely. It's not like there aren't other factors that come into this, right? But that the light is a very significant determinant. And how much sense does it make for you to say, use a bright light therapy lamp at work and then wear sunglasses outside? This is like stepping on the brake and the gas at the same time. So people need to think, they need to get bright visible light in their eye during the day, no matter what. Otherwise, they're just not going to have the same really quality of life levels of neurotransmitters and hormones as somebody who does.
So at the end of the day, it's not advisable for people to wear sunglasses at all because it is affecting many different aspects of your body, from your hormones to your melatonin, to your sleep, just to your circadian rhythm. So we need to get the message out there that sunglasses are not to be recommended at all. Now, what about the so-called UV damage on the eyes that a lot of these ophthalmologists and optometrists are saying, and what factor does that play?
Well, I find it ironic that people are worried about sun damaging their eyes when, the incidence of ocular diseases has exploded since we moved indoors and out of the sun. It's very well appreciated that you need ultraviolet light and all the spectra of light to have a healthy eye. And now we're pioneering treatments and really these treatments have been available for a long time, but they're now getting more and more press, in part because more and more people have these eye diseases, but we're able to treat diseases of the eye with light, specifically red, infrared light. I wonder what the options are going to be for ultraviolet light. And then the one exception to the sunglasses moratorium for my patients and myself is that there are certain situations like when the Arctic or sunny, snowy environments where the albedo effect and the reflection can actually irritate the eye and be too much. But this whole vilification of the sun has been really something that's enriched sunglasses, sunscreen, and other companies without actually providing an actual public health benefit, in fact, a detriment.
So our children, the next generation, we should be telling them to get outside, allow the light to come into their eyes, the natural sunlight, not to wear sunglasses, not to put suntan creams on unnecessarily, and obviously not to sunburn. And then obviously to use, possibly you were mentioning before, something like this, which is, zinc, zinc oxide versus something like this. It's got all the chemicals in, all the toxins. So, this is by Badger, non-GMO, non-nano, non-comedogenic, hypoallergenic, non-nano zinc oxide.
Yeah.
Something like that is preferable for people.
Right. And that's actually, I was out on the river yesterday, got burned because I've been working inside all week. Yeah. And, I'm going to go out on the river again today with some friends, and I'm going to be relying on some sunscreen to avoid burning. And it's going to be a zinc oxide base. Okay,
great. And the last question is, how do we biohack, our lives and improve our consumption of light? What can we do?
Right. So, the simple answer to that is sell all your worldly possessions and live in the woods. But for those of you who can't afford or don't want to do that, the answer is really, take your cues from nature. Yeah. People want to make this complicated and sell you all kinds of different things. But at the end of the day, we're optimized for natural light, natural sunlight. So I tell my patients, got to make sure that your bedroom is dark at night. If there's a street lamp outside your home, you got to get blackout curtains, and you got to make sure that they're fitted tightly to the window so that the light's not coming in. When it comes to, you know, light bulbs in places where you are after dark, make sure that they're a low color temperature. Don't have a lot of blue and green light getting into your eye. Don't watch TV and things like that really close to bed, because it'll really mess up your circadian rhythms, ruin your sleep.
Yeah.
And then when it comes to therapeutic lights, integrating those into life is really important, especially for people who are at say an office job. They can't control the lighting that they're in. They can't afford to quit, or they can't, change the whatever. This is what they're stuck with, right? For them, they can buy, therapeutic lights that have red and infrared light, and then 20 to 30 minutes a day in front of that light can really give them basically a light supplement to what they're not getting from sunlight. Many people report, reduced pain, better stamina, endurance, energy, and then better sleep at night because you're helping the melatonin production in the skin.
Okay.
And then sauna is another great option that you and I have talked about.
Yeah.
So all of these, and what's funny is that, sauna and fire light are what our ancestors used. It's not a coincidence that people brought these things with them into cold, snowy environments, and that all over the world in northern climates, sauna and sweat lodge, whatever you want to call it, is a staple of people's lives. It's just part of what you do, and it should be still part of what we do in order to be healthy.
Oh, fantastic. And just one last question that I've got personally is that sometimes if you get up and in the middle of the night and you need to go to the toilet, but then you switch on the light. Now, how long does that light, that blue light and that green light that comes off your bathroom, sort of downlighters, the lights in your bathroom, how long, of exposure do you need for it to really damage your circadian rhythm and affect your sleep? Should we have a red light in the bathroom? Should we put on our red, blue blocks, glasses before we go to the bathroom? I mean, how long exposure does it, affect us?
Yeah. So even very, very short exposures can have a dramatic effect. It's going to vary from person to person, even night to night. And at the end of the day, my real question is, why not just have lighting that's not going to disrupt your circadian rhythms? Okay. People can buy light bulbs for their bathroom, their bedroom, that do not emit any blue or green light. They can buy the same, night lights. And what I use, especially when I travel, is a red headlamp. Most headlamps now have a red, or many of them actually have a setting where you can turn on just red LEDs. And the reason for that is that people who are hiking and camping at night may not want to ruin their night vision. And so those red lights allow you to navigate, but they don't disrupt your circadian rhythms and ruin your sleep.
Oh, wow. Clever. Well, thanks so much, Dr. Stillman. Once again, you have shared your expertise, your knowledge. You've got an amazing motto called Light Shapes Life, and I think it's incredible. Anything you would want to just specifically share with my audience with regards to light shaping life and how you found it to be so beneficial to your patients and your community?
We really covered the highlights.
Yeah.
This is the biggest stuff. And I just think people really need to dig into it and take it seriously, because they're spending I see them spending a lot of money on treatment supplements, this, that, the other thing. Okay. Sunlight's still free.
Great. Are you writing books or articles? Are you prepared to sort of get it out there more and more? I know you've got social media handles. Where can people find you?
So people can apply to work with me via my website, stillmanmd.com. Okay. And I have a variety of different, I'm active on Facebook and Twitter right now, and probably will be expanding over the next year. And I write a blog every once in a while at medium.com.
Brilliant. Well, thanks so much for your time. Appreciate it.
Thanks for having me. It's great to be here.